Hi, I'm Dr. Seth Eberlin. I'm a board-certified plastic surgeon here in Walnut Creek, California, and today we're talking about gynecomastia. Now, gynecomastia is the medical term for male breast development or male breast tissue that is either pathologically or aesthetically not how we want it to be. So, a lot of the times when people are going through puberty, and when I say a lot of the times, I literally mean more than 50% of the time, boys turning into men tend to develop some sort of breast tissue. Now, that breast tissue can either be very prominent or not prominent at all, and it can either be temporary or permanent. And patients who have a little bit of temporary tissue, not an issue. Patients who have more temporary tissue, it can be a little bit distressing socially, but if it's temporary, it's not going to be there forever. Now, there are some patients who develop permanent breast tissue or glandular growth, and that can be something that just socially is uncomfortable. They don't like to take their shirt off at a swimming pool. They don't feel comfortable in tighter shirts, and this is something that we can very effectively address. Now, there's a few different ways to address this, and it depends on the severity or the amount of tissue that there is. For somebody who has a small amount of excess breast tissue, and that can just cause a little bit of puffiness in the areola region or just a little bit of a contour irregularity. That's a relatively straightforward procedure. And what we do is you make an incision just at the border of the areola from kind of 3 o'clock to 9 o'clock. That lets me go in, identify that excess glandular fibrous tissue, remove that, suture the incision, and we're done. It's a fairly quick procedure. It's a fairly quick recovery, and it really does make a pretty quick, dramatic result. Now, for other patients who have a little bit more diffuse tissue or maybe some skin laxity, there's some different ways to address that. And that tends to be most of the cases. Most patients who have some extra breast tissue or glandular tissue, they also have it kind of moving either medially or laterally. And we don't want to spot treat something. We don't want to just go in and say, okay, we're going to take out this little patch and that's it. We want to blend everything and make sure it looks even. So in that case, oftentimes we'll do a little bit of liposuction kind of around that area to blend it and remove the excess volume to make sure everything matches. Or in the case of somebody who has excess skin, we can kind of remove skin from around the areola, or in a more extreme case, you can make an incision underneath in what we call the inframammary fold, and we can remove a lot more skin that way. Granted, that more skin results in an external scar, but in that case, it's worth having that external scar to kind of compensate for the fact that we had too much skin, because the whole idea is to improve the contour of the chest, to get you back to kind of having a more masculine chest where there's not that extra glandular or breast tissue, and have it fit more of what people are looking to look like without a shirt on or in tight clothes. Now, healing for this, it's kind of a multifactorial thing, because it's not a very painful procedure. So people tend to feel like, okay, cool, I can get back to my exercise routines or get back to my life fairly quickly. However, because we're working on a fairly large surface area and we're removing something, we're creating what's called a potential space. And that potential space is basically a gap in your tissue that we need to heal up and stick together. So I'll tell people all the time that you may feel really good after a week. Don't go back to working out. Still take it easy. Be really gentle with this, because if we push it too far too fast, we're going to create swelling, and then that swelling is going to take longer to go away. So it's really important to let your body guide you and just be very gentle with it and not push too far too fast in that recovery. Because if we're gentle and if we're listening to our body and we're doing what we're supposed to do, the healing process is very smooth. The external scarring is typically really minimal, and it tends to heal very well. The main concerns afterwards are contour irregularities, because we've had excess tissue in there, and I'm removing this excess tissue, and very, very frequently, I'm talking about 75% of the time, in the early postoperative period, things can look a little indented, and that's normal. That's because we just took some tissue out of there, and your body's trying to close up that space, so it kind of pinches everything down. And then over time, usually takes a couple months, your body will build up collagen and even everything out, and everything will go back to nice and smooth. I always bring this up because what I don't want to have happen is for patients to come in for their 1 month post-op and say, oh my gosh, this looks dented in. Is it going to be like this forever? It's like, no, it's going to be okay. It's going to get better. Just takes a little bit of time. The good thing is once that tissue is removed, it's permanently gone. It's never going to come back. So if this is a problem that you've had since adolescence, or it's just something that's developed a little bit later in life, or I've seen some patients who really got into bodybuilding and started to use some exogenous hormones and some testosterone, that can in turn create more breast tissue because you're actually stimulating estrogen production. And in those cases, it's fixable and it's a permanent fix because we're removing that glandular tissue. And once the glandular tissue is gone, it does not grow back. And it's really nice to be able to make these permanent changes because if it's something that's affecting your life and something on a day-to-day basis that's changing how you dress or how you act, we can do this surgery and make you have to never thinking about it again for the rest of your life. So if you have any questions about gynecomastia or any related surgeries, please send us a DM or give us a call.